back real quick to the Boswellia Serrata versus the Boswellia Sacra. There was a question that said, I have pure Sacra oil, but often read that it is Serrata that's reduced and needed to reduce for cancer. Does Serrata or Sacra work too? I've got some capsules as well. And then what doses would be good?
Well, that's a good question. The thing is, I've only used the Serrata, and the reason is that I saw, I know Etienne used to use the Qatari, he said, for brain tumors, but the Serrata, the Boswellia Serrata, will block COX-2 and lipoxygenase. Those are two inflammatory enzymes, okay? One makes prostaglandins for stimulating tumor growth, and the other one makes the different lipoxygenase products. And this is something where what I saw and what I've been using is the Serrata, because I don't want to rock the boat. Let me put it this way. And I don't have enough data on the other one, on the Sacra, for confirmation in the literature. You see what I mean? I go by what's published, what's proven. And if it's not in the literature, if they have any data on this, on the Sacra, to show that it's just, quote, just as effective and blocks these two enzymes, fine, they should send it to you and then send it on to me, because I'm always curious to see what else is out there. Now, Boswellia, the thing is, because of the fact that it blocks inflammatory parameters, it's amazing. It's really an amazing compound. And, you know, I keep telling people, why didn't God give me a new chemical where I could just make billions of dollars instead? I find out it's in the Bible and it's there thousands of years. And I'm like, well, maybe they know something, right? So myrrh's anti-cancer, especially for lung cancer, which is kind of cool. I'm actually looking into myrrh right now for my little toxoplasmosis friends, to see if we can knock them out, because I did find several articles on myrrh getting rid of that. So myrrh gets rid of a lot of pathogens too, so which is really good, especially in lung cancer and stuff. And the other thing is that in the frankincense, this is something where the frankincense is so helpful and so effective in cutting down that inflammatory parameters that I also use it in the oils, in my topical oils, because I find it really, really important that you hit it as many ways as you can, you know, not just, you know, one thing, and not just once a day. This is another problem. The other problem is that, and I went through this myself, because I decided to go on all of this, okay, about 3 years ago, everything, see what my patients were doing. I was almost throwing up from all the nutrients. And I realized that, Dana, you can't do a lot of these 3 times a day. There's only certain ones that you absolutely need 3 times a day. Curcumin and frankincense, you definitely must do that. But all the rest of them, many of them, you can cut down to twice a day, and even take a day off periodically, because you want to make sure that you've got a quality of life here and you're getting rid of these cancers. And the thing is, yeah, you want to get rid of them as much as possible, as quickly as possible. But if you're going to be nauseated and you can't take anything, well, what's the point? That's ridiculous. And this is why I've been looking more and more into this and seeing how are we going to modify this for patients, especially since a lot of cancer patients, because of the acid being released by the tumor cells, a lot of patients suffer from nausea, okay, and too much acid in the stomach. So this is where the Tagamet can help, you know, cimetidine, with killing 2 birds with 1 stone, raising the immune system and stopping the acid. But this is why the proton pumps are stupid. They basically don't help you at all. They stop the acid, but very often it's caused from something else. And that's why you have to make sure what else is causing it. If it's Helicobacter pylori, which is a nasty little beastie that can cause all sorts of gastrointestinal tumors, right? It's a pathogen, right? And Nigella sativa, black seed oil, will help to keep it down and at bay. Black seed oil, they say it cures everything but death. And I'm beginning to think they're correct. I mean, this is like amazing stuff. It has thymoquinone in it. It's a substance that's very, very anti-cancer. So I'm finding some of these things, like, you know, I'm the doubting Thomas, let me put it this way. I mean, I always have been, but I won't rule something out just because I doubt it. I'll look it up and I'll research. And that's the difference. That's why every morning when I'm up and I'm in the living room, I'm on my cell phone researching for about 2 or 3 hours every single day. And I've been doing this for how many years? 45?
Yeah.
I did small break though for a couple of years when my daughter was little because I didn't think that was fair. I was still giving talks and things and still reading in the library, but I at least cooled it a bit on that particular thing. I thought the kid knows I'm crazy, but she doesn't need to know how crazy. All right. Yeah, that's okay. But she's seen some of my patients too, where she's like, boy, Mom, why'd you do that? And I'm like, oh, Courtney, you don't want to know. You stay, you're fine. Just look at this. But it's one of these things that the more I learn, the more I realize how much we can do ourselves, and that why sauna is good. In fact, I'm probably going to have to start hitting the sauna too for whatever these creatures are that I've got in my body from the bird mites. Who gets attacked by bird mites, right? I mean, this is weird. But the sauna helps to kill off a lot of the pathogens in the body. It gets rid of a lot of the toxins too. It sweats them out faster. And then the thing is that if you're taking things like zeolite, chlorella or spirulina, you should take it separate from anything else. Okay. And then like late at night or real early in the morning, and then make sure that during the day you get some trace minerals, because you don't want to strip out your trace minerals. One of the things that I've found in cancer is that's very common is a magnesium deficiency. Now, I don't know whether those tumors are eating it up or what the heck they're doing, but there's a magnesium deficiency in a lot of my patients. And so I make sure that they get enough magnesium, and there's some magnesium creams that they can use on their body too if they get cramps or things like that. So these are also important points that I think, in general, you need to look at and you need to cover.
Absolutely. And I think one of the things that I found too is that when some of the clients come and they put magnesium spray, a topical spray, and if it starts to burn on their skin, I found that those are the ones that tend to be the most deficient in magnesium. So I tell them, if you've got any kind of sensation, please continue to take it until you have that anymore, because then that lets me know that your levels are starting to come back up to what your body needs.
Well, that's a clever trick. That's a really clever trick. What I ended up getting was a cream that they sell in the UK called Naturally Mum, and it smells like lavender, so it has lavender in it, and lavender is anti-pain, and I get a lot of leg cramps and stuff, so I use it, and it's not greasy or sticky, and that I find very helpful, because a lot of my patients can't take magnesium because they get diarrhea.
Right.
Oh, and that's a real pain in the whatever's, and literally. And this is something where you need to make sure that they're still getting that magnesium and so on. I'm also giving my patients a pinch of boron a day to help to get that fluoride out of the pineal gland. Now, when you look at the data, when the pineal gland is being inhibited by fluoride and by aluminum or aluminium, as they say in the UK, the problem is you're not making the melatonin. Mm-hmm. And we found this in nurses that were doing the night shift that had the lowest levels of melatonin and the highest levels of breast cancer. Wow, that's scary. Mm-hmm. And how many of us sit up half the night in front of light, right? Watching a computer or watching a movie or whatever, and going to bed late and having the light on and not being able to get a decent night's sleep where they can actually activate the melatonin. And this is really important too. So these are some of the things. I had one patient, believe it or not, she would sleep with white light over her head because she didn't like sleeping in the dark. So she had this white light. And I said, look, just go out and get a red light. I don't care if they think you're a hooker. Just go out and get a red light, because that's not going to interfere. But if you've got a blue light or a white light, it will block your melatonin. And she was like, yeah, she was really cute. She was like, oh, my family's going to think I'm crazy. I said, no, they're not. I said, tell them why. I said, but this is where a lot of us don't appreciate or realize this, that there are many factors that are involved in getting cancer. Cancer does not usually come overnight, except for me. It did in 2 months when my best friend was killed. And that just 20 years of age, who gets a breast cancer at 20? You see what I mean? And I was like, emotion, stress, trauma, etc. Not to mention the food in the Midwest. Into detail. Mommy's cooking. Sorry, Mom. I know you're up there someplace. But I mean, it's like, I didn't even know that any of these vegetables could taste good. Wow, so much for steaming.